So good afternoon, everyone. I think this work remind me many things can happen over a coffee. So this work actually we started. I'm Nilanjan and my co-author is Dhananjay. So we used to work actually in the same organization, and we started this over a coffee, chatting with what should we do, especially when there is no funding. And we have come up with a product which is submitted to a journal now and is under review. And that's how the journey was for the last 2 years. And to talk about one thing, what is important is that, not only India, but in many developing countries, data is a huge challenge. And we don't have local level data. There are data with the government, but it's not publicly available. So that's how actually we cannot bring change or do or generate or evidence more research evidences at the ground level. So that's where this work started. We also faced a lot of difficulty because we were not having data of green spaces at the city level, in urban areas or city level. So uh, you can start the presentation. Sure. So I can continue. No issue. So we were not having data of any cities of green spaces or in urban areas. Okay. So we thought of actually, how to proceed with it. So my co-worker Dhananjay is actually qualified in MTech and he is a GIS specialist also. So through GIS and having a list of public parks which is accessible to the public every day, right? So from that list, we have identified those parks in the through GIS, ArcGIS, and then we have mapped from that to the nearby neighborhood. We have identified the accessibility, and even though further moving ahead to segregate the data a little bit, is the we have taken the equitable approach to the accessibility, and that's how we identified like are the vulnerable communities or backward communities can able to access those public parks or not. Oh, okay, it's not moving, not escaping. Uh, yeah, is it? Yeah. So I'll not go through everything, but I would like to talk about a little bit how we have taken the planetary health approach. Is it 2 minutes? So they were solving it out, right? Okay. So so availability, accessibility, and utilization approach to the public parks, we have taken it. Okay, so that's how we have proceeded with by taking the planetary health approach. So I have two, yeah, I have two objectives. The first is to assess the distribution and accessibility of the public parks in Bengaluru city using geospatial distribution. And the second objective is to identify the equitable access to the public park. And here we have not considered utilization of the public parks because we don't have data. And we have not done the primary survey also. To talk about data and methods, so we have these three steps of the methodological structure we have followed. The first is the mapping, is slightly matching with the objective also. The second is accessibility, and third is socioeconomic data. We have taken it from Indian census, and the four indicators that we have taken: density, wealth index, population under 6 years, and scheduled caste population. So this is a proxy wealth index. It is not available in the census. What we did actually, we have taken it from another authors. So they have published the data with the proxy wealth index. We have communicated, contacted them, got the raw data, and then we have analyzed and correlated with our data, and that's how we have proceeded. So, so proceed. Yeah, so the first result about the spatial distribution of public parks in the Bangalore city. So we have 198 wards, and of that, 19 wards do not have a single park. So these wards are actually mostly currently the last 2 to 3 years, urbanization is happening very rapidly. 36 wards have only one park, and this is the name of the parks actually have the highest number of parks and largest area under the park. Secondly, this is the distribution through GIS what we found, and this is a slot gist of the hierarchy of the park. This is given by the government of India, these hierarchies, and based on that, what we found, we have mapped, right? Based on the mapping, we have identified the area, percentage, and mean area of each park. Then second is accessibility. I'm not going in detail much, but accessibility we identified based on the hierarchy of the parks. Okay, so this is housing area park. This is at the very ground level, very near to the neighborhoods. Then we have neighborhood parks. Neighborhood parks actually, have little distance from the neighborhood and service area. Based on service area, services are also increased based on the household park. Then we have community parks. So it is little bit larger than the household parks and have more services and little bit distant from the neighborhood. Yeah, just yeah, in that. This is final. So this is district park. This is also district park and sub-city park, right? This has the larger area. Okay, so it is inaccessible to many population. So only the neighborhood actually they can able to access the district and sub-city parks, and it considers the larger area and located mostly in the central part of the city. Then this is the correlation thing. Okay, so this has been correlated with this is the socioeconomic indicators, and that you are seeing the hierarchy of the parks. And we have seen mostly for each and every indicator, we found actually, there is a substantial gap in accessibility by the by each of these socioeconomic indicators. Yeah, last. Yeah. So this is the conclusion. So what we have proposed based on our findings is that we are looking actually beyond biodiversity. Biodiversity is located in the forest. There is a separate forest, and there is a Forest Rights Act also. But we are looking actually beyond biodiversity, where physical health, mental health, and overall well-being we can actually provide to our citizens or the city population. Let me think.
I'm sorry, everyone has a 5-minute.
So I'll just finish. So 1 minute. It got actually from.
If anyone has questions, they can
so-
comment up to you.
So
Thank you so much,
I'll
Nilanjan.
finish with the last one. Okay. So this one I was talking about. Okay, let me finish. It's not yet. So,
Thank you.